Call the House Health and Welfare Committee to order. First order of business is roll call. The secretary has taken a silent roll. We do have a quorum present, so we are ready for business. First item on the agenda is RS 30879, Representative Blanksma. Please identify yourself and who you represent, because you're a stranger to us most of the time.
Thank you, Mr. Chairman. I'm Representative Blanksma. I represent Valley, Boise, Custer, and Elmore counties in District 8. I'm here to present RS 30879. This is with regard to Medicaid and state plan amendments and waivers. What this does is prevents the department from requesting any state plan or amendments without the approval of the state legislature. With that, Mr. Chairman, I take any questions.
Committee, any questions? Not seeing any motions. Somebody want to make them? Representative Dixon.
For a motion.
Motion's always in order.
I move that we introduce RS 30879.
Committee, we have a motion to introduce RS 30879. Although any discussion? Not seeing any. All those in favor signify by saying yes.
Yes.
Opposed, no. Motion passes. RS 30879 is introduced. Next item on the agenda is RS 30897. It's like a dyslexic number. We switched the last two and we read them differently. Representative Blanksma.
Thank you. Again, Representative Blanksma, District 8, Boise Valley, Custer, and Elmore counties, here to present RS 30897. This is another really simple, straightforward RS. This returns the Immunization Registry to an opt-in rather than an opt-out. That change, I believe, was made in 2010. And if you have any questions, I'd be happy to answer them.
Committee, any questions for Representative Blanksma? Representative Healy.
Mr. Chairman, a motion.
Motion's always in order.
A motion to introduce RS 30897.
Committee, we have a motion to introduce 30897. Any discussions, questions? All those in favor signify by saying aye. Aye. Opposed, no. Motion passes. Next item on the agenda is RS 30898. Board of Medicine, Representative Blanksma, one last time.
One last time, Mr. Chairman.
Hopefully it's just the last time for the year or just for today.
We can make that happen if
Okay,
you want.
okay.
Representative Blanksma, District 8, Elmore, Boise Valley, and Custer counties, here to present RS 30898. This is with regard to the Board of Medicine, and what this does is gives the responsibility to collect maternal mortality data to the Board of Medicine. They have the authority to create subcommittees, and they would then have the authority to put an MOU together with the Department of Health and Welfare, which is currently collecting this data, and to review it and do an annual report to the legislature. And with that, Mr. Chairman, I would answer any questions.
Committee, any questions? Representative Dixon.
For a motion.
Motion's always in order.
I move that we introduce RS 30898.
We have a motion to introduce RS 30898. Any questions? If not seeing any. All those in favor signify by saying aye. Aye. Opposed, no. Chair votes aye and motion passes. Now we can see how easy it is just to introduce RSs here. Redmond, you should be easy next time around. No problem. Just roll right through them. Okay, so next item on the agenda is rules. And with that, I will turn the gavel over to the vice chair, and he will go through some of our rule review.
Thank you, committee. If you're having problems with getting the rules on your computer, please come see Irene, and we'll get them fixed. There's some issues with IT. If you're IT challenged like I am with computers and technology, sometimes it gets a little wild. Also, those of you who are presenting today, if you would specifically show us the changes that were made in the red lines, because ours are just, they're showing red and they're not showing us the actual changes. If there was changes in the rules, if you could just be real clear with that on the committee, that would be very helpful. So up right now is docket 160603, 2301, daycare licensing, Aubrie Hunt. And if you could state your name and affiliation for the record, and the podium is yours.
A lot of paperwork, I'll send that out. Good morning, Mr. Chairman, members of the committee. Thank you for the opportunity to come before you today. My name is Aubrie Hunt, and I'm the program manager for the Idaho Child Care Program and TANF program at the Department of Health and Welfare's Division of Welfare. I'm here today to present docket 160603-2301, which contains a new IDAPA chapter for daycare licensing in Idaho. The docket can be found on page 727 of your Legislative Rules Review book. Understanding you may have had issues with that. Does anyone need some time to find it? The Idaho Department of Health and Welfare licenses approximately 800 daycare programs in our state each year. Licensed daycare providers follow foundational health and safety standards set by the state in IDAPA to ensure that children in licensed daycare are in safe, healthy, nurturing environments. At the request of the House Health and Welfare Committee, we have written the Idaho rules for licensed daycare into its own new chapter of IDAPA. This separates daycare requirements from foster care requirements, and the timing of this was an important opportunity to come in compliance with recent federal monitoring findings. Due to the administrative rulemaking deadlines, we were not able to conduct negotiated rulemaking, so the changes are limited to organizing and simplifying the chapter, reducing the overall word count, and aligning to existing state or federal statute and those federal monitoring findings. Changes to the rule include aligning to state and federal law requiring child care providers to provide a safe sleeping environment for infants, full implementation of annual inspections in accordance with federal law, and correcting child record retention requirements to comply with federal law. And I'll further explain each change. First, state and federal law requires child care providers to provide a safe sleeping environment for infants to limit the risk of sudden unexpected infant death, previously known as SIDS, positional asphyxiation, and suffocation. IDAPA now incorporates safe sleep practices as a health and safety requirement, and because this was existing in federal law and state law, this is not a change in practice for providers. And while Idaho state daycare licenses renew biannually, federal law require all child care providers to have at least one inspection each year. An annual inspection schedule is already in place for providers that are licensed by a city or participating in the ICCP subsidy program. In this chapter rewrite, the IDAPA has been updated to require an annual inspection of all state licensed facilities, and the cost of these inspections is covered with our existing child care funding as described in existing state statute. And lastly, our federal program monitor observed gaps in our child record keeping requirements. I can't say that one today. To correct this, IDAPA was updated to require child care providers to have a record of any allergies or medical conditions that may impact a child's care and how to respond to them in an emergency. This also includes receiving parent permission prior to administering medications to children. This was a long existing business practice recommendation, and most providers indicated they were already maintaining these records, so we were happy to bring IDAPA current in these areas. The proposed chapter is not more stringent than any federal law. The changes are only the minimum required to maintain federal compliance, and the rules continue to be significantly less restrictive than all other nearby states. There is no fiscal impact to state funds due to this change, and we will use pre-existing processes and automated systems, and there's no changes to licensing fees as a result of these rule changes. The department offered public hearings, though none were attended. So, with an understanding that a new chapter is a significant change and to ensure that impacted constituents were able to participate in the process and had an awareness of the proposed changes to rules, IDHW childcare program staff toured the entire state, meeting with 32 unique childcare programs at their facilities. And also as a part of this travel, we had in-person meetings with all cities that operate licensing programs. We conducted 9 evening meetings for childcare providers in Caldwell, Lewiston, Moscow, Coeur d'Alene, Boise, Idaho Falls, Pocatello, Twin Falls, and Meridian. More than 200 attendees joined us statewide. Participant feedback was positive, with an appreciation for the improved simplicity and organization. Most attendees indicated they had no impacts from the proposed rule changes due to previous compliance with city licensing or the Idaho Child Care Program, or just common business practices. And finally, these rule changes were presented to the Idaho Child Care Advisory Panel, where attendees indicated support. These rules ensure compliance with federal law. They incorporate updates to state law, and we streamline the language to comply with the zero-based regulation efforts. I respectfully ask that you approve these pending rules as final. Mr. Chairman, members of the committee, this concludes my presentation. Thank you for your time today, and I'm happy to stand for questions.
Thank you, Ms. Hunt. The committee, if you remember last year, we had them separate those two out. That's why this is quite a big change. Also, remember that every year, if we were to adopt these rules, just because it's 1/5 every year that we review, we could still bring up a set of rules like this at any time at the request of the committee. So we could next year review if we saw any community concerns or anything like that. So with that, I'll take any comments from the committee members. Seeing none. Oh, Representative Vanuatu.
Thank you, Mr. Chairman. And just as a question, how many daycare places do you license and investigate on an annual basis? Because you're supposed to, from what I read on this area, you're supposed to check them once a year. So how many facilities are you?
Chairman
Ms. Hunt.
Vanuatu, let me bring up my numbers for you. Give me just a moment. I ran these this morning, so I know that they're current. In Idaho right now, there are 380 city licensed child care facilities. There are 787 facilities that accept subsidy, so those programs are already being inspected every year. And then there's 794 state licensed facilities. And so that totals at about 1,200 childcare facilities operating in our state each year, with about 200 of those who will need that inspection every single year as opposed to every other year.
Thank you.
Any further comments from the committee? All right, a motion would be in order. Representative Redmond.
Thank you, Mr. Chairman. I move to accept Rule 1606032301.
Motion's on the floor to approve docket 0603-2301. All those in favor signify by saying aye. Any discussion before that? Nope. All right, all in favor say aye. Aye. Any nay? Any opposed say nay? Chairman votes aye. Motion carries. All right, thank you.
Thank you.
Next up is docket 160602-2301, foster care licensing. Ms. Sevcik, I can't ever say that, correct? I think if you could state your name. Sevcik, thank you. If you could state your name and affiliation for the record, and podium's yours.
Yes, good morning. Mr. Chairman, members of the committee, thank you for the opportunity to come before you today. My name is Julie Sevcik, Program Manager for Policy and Program Development with the Department of Health and Welfare, Family and Community Services. I am here to present docket number 16-0602-2301, foster care licensing, which is found on page 666 of your legislative review book. Today, I ask you to approve this pending rule as final. Updates to IDAPA Chapter 160602, Child Care and Foster Care Licensing Rules, were requested by the House Health and Welfare Committee during the last legislative session. This request was to separate the child care licensing rules from 160602 and put those rules into a separate chapter, which will be Chapter 160603. Excuse me. This was intended to provide clarity to the legislature germane committees, and the public as to which rules apply to foster care and which apply to childcare. Small changes were made in this rulemaking that were overlooked in the prior year's rewrite that was completed to comply with Executive Order 2020-01. Additionally, a section was added to align with Federal Bureau of Investigation requirements for background checks for relatives and fictive kin who are identified as an emergency placement for children entering foster care. This section is required by the FBI Compact Office to be promulgated in permanent legislation in order for Idaho to have authority to complete these background checks, known as Purpose Codex. Idaho does not currently meet this requirement, but has been allowed to use this background check under temporary authority by the FBI Compact Office until October 1st of 2024. At that time, if we have not complied with the requirement, the state is at risk of losing the ability to complete Purpose Codex background checks when a child enters foster care. This would prevent a child from being immediately placed with a safe individual who the child knows and it feels comfortable with. This rulemaking is not anticipated to have any fiscal impacts on the state general fund or any other known funds. Facts and Self-Reliance provided opportunity for public involvement through 2 public hearings. No community partners attended either public hearing, and no written comments were received. In conclusion, the child care licensing content currently in Chapter 160602 is being removed and placed in the new Chapter 160603, as requested by the House Health and Welfare Committee, and a section added to comply with federal requirements for Purpose Codex background checks. Mr. Chairman, members of the committee, that concludes my presentation. We ask you to approve this pending rule as final. Thank you for your time, and I stand for questions.
Thank you, committee. Thank you, Ms. Sevcik. Any questions? Representative Healy?
Yeah, thank you, Mr. Chairman. Ms. Sevcik, I just have a couple of clarifying questions, if you don't mind. On page 39 in our packet and page 674 for you, I believe, section 201, on your opening paragraph there, it says foster parents must be physically and emotionally suited to care for children. Can you help me understand what physically and emotionally suited means?
Ms. Sevcik.
Yes, thank you, Mr. Chairman, Representative Healy. Yes, every family who is licensed to be a foster parent in Idaho participates in a home study. And that home study helps us to determine whether or not they are physically and emotionally suited to be foster parents. There's many different qualities that we're looking for in foster parents that will help them to be able to navigate the difficulties of being a foster parent and the emotional stress that can add to every family situation. So there are impacts to families. There's grief and loss that foster parents experience as they care for a child and help them to reunify with their birth parents or their legal caretaker. And we want to be able to assure that they are prepared to do that.
Thank you. Follow-up?
For follow-up, yes, Ms. Sevcik.
Thank you. Just continuing on down that line, as I read this whole section, moving on to the 02, I don't know if that wasn't finished. It just says be of good character. All the rest have a definition, but that one just says be of good character.
Yes, thank you, Mr. Chairman, Representative Healy. Yes, that one is very vague, and we have had many conversations in regards to the vagueness of be of good character. One of the areas that we have really identified in being able to use that quality is that we want families who have good moral values, who support birth parents and the reunification process. And at times that can be difficult to put into very specific rule terms.
Okay. Sorry, I'm still.
Is that clear? Or you have
That's
another
still
follow-up?
good. Sorry, follow that. I don't know if that's clear, still kind of clear as mud, but I believe, sorry, follow up one. I think I had one last one, and that was number 11 is what I have noted here of literacy. What is there a definition for functional literacy? Again, that one was just a little vague for me.
Ms. Sevcik.
Yes, Mr. Chairman, Representative Healy. So functional literacy is part of model licensing standards that were implemented as part of the Family First Act in 2018. So what we are looking for with literacy is that an individual would be able to understand a prescription bottle, be able to read what is prescribed to a child and be able to administer that medication appropriately, to be able to understand the specific direction provided by mental health providers, physical health providers, dental providers, as well as the department and social workers that they're working with.
Thank you. Just, if I may, Mr. Chairman, for a statement.
Yes, go ahead.
Thank you. I would like to see this section cleaned up a little bit more and have more of those definitions put in here so that this is more defined. Clearly, there are some definitions, but they're not defined in here. So that's my statement. Thank you.
You bet. And just remember, committee, we can take this same rule up again next year. We appreciate you taking that out and helping us with the separation that we requested. Chairman Van de Waal.
Thank you, Chairman and Ms. Sevcik. During your presentation, you talked about some issues with background checks and compliance. What is the issue there, and why do we have until October to solve that, and what's the fallback if we don't?
Okay. So,
Ms. Sevcik.
yes, Mr. Chairman, Mr. Vice Chairman. So to further explain what occurs sometimes when children enter foster care through an imminent danger or through an endorsement and are placed in our care through a court, we are able to immediately identify a relative or a fictive kin provider that the child could be placed with. In order to do that, we ask for this purpose codex background check through law enforcement to assure that they don't have significant criminal history that would prevent them from being foster parents or that would indicate that they're not safe for a child to be placed with. This requirement is through the FBI Compact Office, so it is a federal requirement that we have this rule promulgated in our own rules to assure that we are meeting their requirements, which are very specific towards if an individual has a purpose codex background check run for them, that they immediately comply with having their fingerprints taken within 10 days, and that they will follow through with any other requirements. In addition, if they do not comply with the background checks, and if they were to fail Idaho's criminal background check, that Idaho would immediately remove the child from that person's home.
Follow up.
Thank you, Mr. Chairman and Mrs. Sevcik. I'm still trying to understand, though, what the hangup is, because you said something about, well, if we don't comply, we have until October of this year. So what's the issue? Is there some issue that we haven't followed through on the background checks that we have to resolve by October? I understand why we're doing the background checks and the process of all that. I'm trying to understand what the issue is that comes up in October of this year.
Ms. Sevcik.
Yes, Mr. Chairman, Mr. Vice Chairman, Idaho has not promulgated that rule into our own rules. We were negotiating through the background check unit to have this as part of our policies and standards rather than in rule, but that was not acceptable. And they did require that we have this in Idaho rule or law. This is the only ability that we were able to negotiate with the FBI Compact Office to assure that we can continue to use the purpose codex background checks.
One more follow-up,
Another follow-up,
Mr. Chairman. So, Ms. Sevcik, so we needed to put it in our rule, but it's not in our rule, if I understand you correctly. And so is the process as soon as we leave town to make a temporary rule to comply and that we don't get to review it? Or as you might sense from me, I don't like temporary rules. I'd rather have the rule come before us while we're still here. And I'm just trying to wonder, if there's a rule that needs to be in place in order to be in compliance, why isn't that in the rules that we're reviewing?
Ms. Sevcik.
Mr. Chairman, Mr. Vice Chairman, on page 713 of your rule book, you will find where we have added emergency placement of children. This is where we have put the rules required by the FBI Compact Office in order to comply. If these rules are passed this legislative session, we would then be in compliance, and the October deadline would no longer apply.
Thank you.
Committee, any further questions? Oh, Representative Blanksma.
Thank you, Mr. Chairman. Just to follow up on what Representative Healy was alluding to, is there some sort of standardization as far as foster care parenting nationally? Is there some sort of handbook, some sort of something, rather than a really vague description of what you may find to be morally righteous?
Ms. Sevcik.
Mr. Chairman, Representative Blanksma, model licensing standards, as I mentioned, were implemented, but they are also not incredibly specific because a home study process, every individual family is so different, and how they are able to consider being foster parents and to be able to work through the issues that come along with being foster parents, supporting children, working with the department, supporting birth parents in the reunification process, or being able to transition a child to a permanent home can sometimes be more of a discussion rather than a specific requirement and ability to describe exactly what we're looking for.
Follow up, Mr. Chairman.
Follow up.
So based upon some knowledge I have of some conditions in my district, is there some sort of appeals process if the determination has been made that there is some sort of moral issue with a couple or a single person or what have you? What exactly, what gives one person the right to determine this? This is my question. I think this is what Representative Healy was getting at, in that we already have an amazing dearth of foster parents. And I don't know that I'd want one person coming into my home and telling me whether I was, you know, a morally upstanding individual or not, even though I have voters that tell me whether I am or not every 2 years. I volunteer for that, but I just question about if what we're looking is qualified foster care, as many people as we can get to provide quality care. Is there some sort of appeals process? Tell me what that looks like.
Sevcik.
Yes. Mr. Chairman, Representative Blanksma. So when a home study is completed, it is done in collaboration with the family. So that's done over several home visits or phone calls, follow-up questions to discuss any concerns that the social worker or family service worker may have related to that family. The home study is then reviewed by a supervisor. And in addition, when a worker has concerns about a family being able to be licensed to be foster parents, there are many conversations that occur between the worker and the supervisor to determine if this is a family that can move forward in the licensing process, or if we need to have some of those crucial conversations with them, specifically around what are our concerns, how can they learn more, gain additional skills in order to be exceptional foster parents that we're looking for. At that point, if the department determines that they cannot be licensed, there is an appeal process, and they can go through the Fair Hearing Rule Unit, and they can present why they believe that they should still be licensed as a foster parent, and the department would then provide information as to why they do not have the qualities that we're looking for.
Thank you. Follow up for Mr. Chairman again.
Thank you, Mr. Chairman and Ms. Sevcik. Under these guidelines, can somebody determine that somebody who is pro-life not be eligible for foster care? Can somebody decide that that's not a good moral position and not be qualified for foster care? I mean, we've seen some of that in other states where if you're a strong Catholic, you can't qualify for foster care. So under these guidelines and these rules that we are adopted, is that possible in Idaho?
Ms. Sevcik.
Mr. Chairman, Mr. Vice Chairman. It's a difficult question to answer, but I can tell you in my years of experience, we have families from all backgrounds, from all beliefs, from all areas of political beliefs as well as religious beliefs. So could it happen? It would be difficult for me to say absolutely not. I don't foresee that it would happen.
Follow up, Mr. Chairman.
Thank you, Mr. Chairman. And I just, you concern me when you say it could, and that's my concern with these rules. If that can happen, that someone in the department decides that if you are not of this understanding and belief of raising a child, that then under these rules, they could determine that you're not suitable, I guess say, for foster care. And I don't know how to tighten up or change those rules, but it is a real concern on my part that there's enough flexibility in the rules here because of what Representative Healy and Blanksma pointed out, the vagueness of the descriptions of moral and good character can be determined in a wide spectrum. And so I'm not sure how to fix the problem, but I do have some concerns with the rules being vague enough that you could end up there.
Thank you. Thank you, Representative Vanderwater. Any further comments on this? Go ahead, Representative Wilson.
Vice Chair and Ms. Sevcik. I, as a licensed social worker, I think I've worked on a home study or two, and I don't remember there being any questions specifically about political affiliation on the home studies. I do think they ask about religious background just so that they can know that about the family, but it's not something that's ever used against them, is my understanding. Can you clarify a little bit more about those questions that are asked of the family?
Ms. Sevcik.
Yes, Mr. Chairman, Representative Wilson, yes, you are correct. We ask about religious affiliation only so that we can assist in the matching of a child with a foster family. The reason we do that is if we are able to place a child with a family that has the same religious background, it assists in ensuring that they can continue to attend the church of their choice. We do not ask questions about political backgrounds or personal beliefs related to any of those political situations. I lost my train of thought for a moment because I was trying to find the right word that I was looking for. Does that answer your question? Yes, thank you.
Any further questions from the committee? Thank you, Ms. Sevcik. Committee, just remember, we either approve the docket, we reject it, or we approve it with some exceptions. My recommendation would be that we just bring up these last two and review them again next year and just keep our eye on them until we're really comfortable with them. But the committee, it's at the will of the committee. Thank you. Any the motions in order? Well, we can reject it, I suppose. Representative Rebel.
Thank you. I move that we accept rule number 1606022301.
Thank you. Motion's on the table to approve and accept docket 160602-2301. Any discussion on the motion? All those in favor? Oh, Representative Vanderwater.
Thank you, Mr. Chairman. And just for discussion on the motion, I think we've pointed out that there's some very vague interpretations or descriptions on that. And I don't necessarily want to kill the rules, but I do think we need, just as when we passed legislation, we put definitions in. And I think some of this is pretty vague, and I'd like to see more definitions either in the docket or in legislation that goes with it. So I don't see a reason yet to kill the rules, but I'm very hesitant on the rules. My initial reaction would be to go no, just because of the vagueness. But I'm not sure that can be solved in the meantime while we're here. And so I just have some reservations on it, and I'm still not sure where I'll go with this one just because of the vagueness of the definitions.
Any further discussion, Representative Blanksma?
Thank you, Mr. Chairman. I, to some degree, echo the chairman's comments. I find it troubling that we would approve something and then just hope for the best, because my experience does not lead me to a good conclusion when we've done that in the past. And particularly with the Department of Health and Welfare, I have yet to have a condition where we've asked the department to do something and then felt like they've complied to the best of their ability. I've yet to see that. And I haven't been here as long as Chairman Vanderwater. No one has. but I have some serious concerns. Again, though, I'm troubled by what the remedy is, but I feel really uncomfortable, particularly since while the department may not be asking these questions now, it appears that there's nothing that will preclude them from asking these type of questions in the future. And I am concerned about the balance that you're putting on these folks that are going into homes, and the ability of some of these foster parents, a lot of whom I know are really good people and have been challenged by some of these home visitations, feeling really lost and attacked by the department. And so to go ahead and give you more authority through vague definitions, it troubles me.
Any further comments, Representative Vanuatu?
Mr. Chairman, for a substitute motion.
Substitute motions in order.
Mr. Chairman, I make a substitute motion that we hold House Rule 16-0602-2301 for further review until we get some maybe better definitions or explanations from the Department of Health and Welfare.
Do you want to do subject to call chair?
Yeah, subject to call of the chair.
Okay, substitute motions on the docket to hold Rule 16-0602-2301 until further review, subject to the call of the chair. It's a very interesting motion. Representative Rebel for comment.
Thank you, Mr. Chairman, Mr. Vice Chairman, whoever I'm thinking. I have a question for the speaker, if I may. I'm wondering, what is the fallout if we don't pass these rules? Is it going to cause logistical troubles within the foster care system, or what will happen if we just let this sit for the year and don't do anything?
Ms. Sevcik.
Mr. Chairman, Representative Rubel, the issue that will arise will be specific related to the Purpose Codex background check, which means that emergency provision for children to be able to be placed with a relative or fictive kin is at risk, and the federal government could withdraw our ability to do that background check, meaning that some children who could be placed with a relative or fictive kin, someone they know and trust, would have to be placed with a non-relative foster parent until we could complete the full enhanced background check through the BCU.
Representative Blanksma.
Thank you, Mr. Chairman. Well, my understanding from what you said is we could still do that up until October. Is that correct? And so you would also have the ability under Representative Chairman Vanderwater's favorite deal of doing a temporary rule. So it doesn't sound like you're in any way incapacitated as far as using that system. That is correct? Okay.
My apologies, Mr. Chairman, Representative Blanksma. Yes, if we were to do the temporary rule, that would mitigate that.
Representative Vanuatu.
Thank you, Mr. Chairman. Just for a comment, I believe there is a lawsuit out there now in regards to rules we didn't approve last year. And then I think there is some danger if we don't. This is just to hold the rules, and we're still here for a little while, a month or so maybe, you know. Yeah, but we have the chance to approve the rules. I think we are in danger if we don't approve the rules, that there aren't any rules then for foster care. So I think the danger is to put this off and not do anything. I don't think there's danger in waiting to get some better explanation, but I think the lawsuit that was filed, I believe, is with the High School Athletic Association. Is nobody approved the rules last year, so they didn't have any rules to operate under, and so they filed a lawsuit, and that's in the courts right now. So I don't think we're in that danger of that unless we get to sine die and we haven't approved the rules. So I don't think we're in that danger at this point, because the rules don't go into effect until we sine die already anyhow. And so I don't think there's a danger of that, but I just want some more comfort with where we're at.
Representative Rebel.
Thank you. If I might ask the chair a question?
That's the chair
I guess-
questions in order.
Thank you.
He's
I
the
don't have,
chair.
the
Yeah.
original. Yeah, I guess I don't have any concern with taking longer and getting a delay so that more questions can get answered. I guess my real concern is I would be very concerned if we sine died without voting on this, because it does sound really important. I do think it's important where possible to place kids with family members as opposed to strangers. I don't know that there's really any latitude at this point to change the rule. So if this is just let's take longer and take it up in 2 or 3 weeks, that's great. I'm totally good with that. I'm just concerned about, the danger that we would leave without addressing it, and then we'll have even less transparency and input into a temporary rule that comes up after we're gone. So I guess it is your intention, I understand, and can you clarify, to bring this up again for a vote before the end of session?
Thank you, Representative Rubel. Yes, it is definitely my intention to pull this back up. We're not going to sine die without having this rule in place or some comfort with where we're at or some direction to health and welfare that what needs to be done. I mean, we can't amend rules, and so we can only reject or accept certain items, lines in there. And so we can reject the whole rule, we can reject it by sections, but we can't amend it. In other words, we can't say that good character is this and put our definition in it. We're not allowed to do in rules. And so this will come up before we sine die. Yeah, we will not leave this building without having resolved some of these issues.
Also, Mr. Chairman, if you could clarify to the committee what happens if our committee reject a rule and the Senate approves a rule.
Then the rule goes into effect, much to my dismay.
So I was just remind the
Yeah.
committee that's the process we have.
Every rule at this point has to be approved by one body or the other. So if we were to reject it and the Senate passed it, then it still goes into effect. Only if both bodies reject it. And I'd like to have both bodies reject or approve it before it goes into effect. But we've tried that several times, haven't got there yet.
Follow up?
Yeah, thank you, Mr. Chairman. With that assurance that we will be taking it up later, I'm happy to support your substitute motion.
All right, the substitute motion again for the committee, if there's no further discussion, is to hold Rules 160602-2301 in committee until call of the chair. Any discussion on that motion? All those in favor signify by saying aye. Aye. All those opposed signify by saying nay. Chairman votes aye. Motion carries. Thank you so much. Appreciate it. Next up on that, you guys are amazing. You put a lot of energy into this and real thought. So it's appreciative discussion for sure. Next up on the docket is the docket 160601-2301, Child and Family Services, Blackwood. Blackwood, thank you. If you would state your name and affiliation for the record, and podium's yours.
Thank you. Julie's a little taller than I am. Mr. Chairman, members of the committee, thank you for the opportunity to come before you today. My name is Andie Blackwood. I'm a bureau chief with the Child Welfare Program for the Department of Health and Welfare, Family and Community Services. I'm here to present docket number 160601-2301, Child and Family Services, which is found on page 658 of your legislative rulebook. Currently, the rule requires licensed social workers, clinicians, and service providers to be designated as the responsible party by the department. The responsible party is the staff person designated for case planning and case management services for children and families who are receiving services through the Child and Family Services Program due to concerns of abuse, neglect, or abandonment. These changes allow non-licensed workers with a background in human services as well as a corresponding bachelor's degree in a human services field to fill those positions that once required only a licensed social worker. The definition of responsible party is being expanded to not rely solely on a social worker to fulfill that role to ensure the safety of children in the child welfare system. Over the past several years, the department has experienced increasing challenges to retain and recruit licensed social workers. Despite implementing key strategies to address these staffing challenges, including but not limited to retention bonuses, overtime pay for frontline workers, pay increases, and specialized recruitment efforts to increase interest in these vital positions, challenges persisted and continued to impact the department's ability to provide quality, timely services to children and families. While prioritizing the hiring of licensed social workers in child welfare, the program needs to have the ability, when the registers are empty of social work candidates, to expand our search to fill safety-sensitive positions and to ensure children are safe and services are provided to families whose children may not be safe. This rule allows for this flexibility. Additionally, this rulemaking expands the employment opportunities for individuals who have human services degrees but might not be licensed social workers. This rulemaking is not anticipated to have any fiscal impact on the state general fund or any other known funds. There were 2 public hearings regarding this proposed rule. Neither hearing had any public comment, nor was any public comment provided in writing. Mr. Chairman, members of the committee, that concludes my presentation. We ask you to approve this pending rule as final. Thank you for your time, and I stand for questions.
Thank you, Ms. Blackwood. Any questions from committee? Representative Wheeler?
Thank you, Mr. Vice Chair. And Mrs. Blackwood, I just had a question about your comment on the no fiscal impact. Help me understand that, because what I also heard was that we're potentially expanding the hiring pool of personnel that will be covering, I guess, that with this expanded definition of family services worker. And so I just want to make sure, are we not hiring more people, and will that not have some sort of impact?
Ms. Blackwood?
Chairman, Representative Wheeler, thank you. We're not expanding the number of people we can hire. We're expanding the number of positions or degrees that are eligible to be hired into the same kind of static pool of positions.
Any further comments or questions for Ms. Blackwood? All right, committee, a motion would be in order. Representative Healy?
Yeah, motion to accept 1606012301.
Thank you. Any discussion on the motion? A motion is on the table to adopt rules 16-0601-2301 or approve them. Any further comment? All those in favor signify by saying aye. Aye. All those opposed, say nay. Motion carries. Thank you so much. Appreciate it. Next up on the agenda, docket number 160719-2301, Treena Clark. If you could state your name and affiliation, and the podium is yours.
Good morning. Thank you, Mr. Chairman, members of the committee. My name is Treena Clark, and I'm the Policy Program Manager for the Division of Behavioral Health within the Department of Health and Welfare. I'm here today to present on docket 16-0719-2301 that begins on page 748 of your pending rules review book. Today, I ask you to adopt this pending rule as final. I have to bring the mic down just a little bit for me. ADAPA Chapter 160719 establishes the criteria and certification procedures for certification as a peer support specialist or family support partner in Idaho. In accordance with the Governor's Zero-Based Regulation, Executive Order 20201, the division has conducted a comprehensive review of this chapter and is proposing several revisions based on that review. In general, the proposed changes provide clarification and remove language considered to be redundant, outdated, or inefficient. But there are a few changes that I would like to highlight for the committee. At this time, I'd like to refer you to page 758 of your pending rules review book. Okay. Page 758 reflects the addition of an incorporation by reference to incorporate the Code of Ethics for Peer Support Specialists and the Code of Ethics for Certified Family Support Partners. These documents are based on principles of the National Association of Peer Supporters and are available online. The addition of section 002 coincides with language deleted later in the chapter. Next, I'd like to refer you to page 760 of your pending rule book. Page 760 includes a new section on certification extensions and a revision to the section on reciprocity. Section 113, extension of certification, is being added based on stakeholder feedback to address hardships some peers face in obtaining all their supervision hours in the timeframes established for certification. The changes to Section 120 are intended to reduce overly burdensome requirements for reciprocity and streamline the process for applicants seeking certification in Idaho. The last proposed change I'd like to highlight begins on page 672 with Section 250. Section 250 sets forth the Code of Ethics and Professional Conduct Principles for Certified Peer Support Specialist. These are the principles that are posted for public online, and as a result, the language in this rule is redundant and is being removed. The same is true for the Code of Ethics and Professional Conduct Principles for the certification of certified family support partners. These principles are also posted online and are being incorporated through the Section 002 edition. These changes are notable because the result is a reduced word of unnecessary wording in the chapter of rule. The provision of support services by family and peer specialists is an essential component of our behavioral health system. The service is so essential to serve individuals in services because it provides them hope. It is the shared experience that is the foundation of the connection between the peer or family provider and the individual or family that is receiving the services. The Division of Behavioral Health is committed to supporting efforts to increase the workforce capacity of peers in Idaho, and we will continue to evaluate our criteria for certification to make sure and ensure that we are implementing requirements that are promoting quality while limiting barriers to certification for prospective peers in Idaho. As part of the rulemaking process, the division did conduct 2 public rulemaking sessions and 1 public hearing. The department did not receive any negative feedback on the proposed rule during the process. This rulemaking is intended to be cost neutral, and there's no anticipated impacts to the state general fund or any other fund as a result of this rulemaking. I respectfully request that the committee adopt this pending rule as final. Mr. Chairman, members of the committee, that concludes my presentations. I stand for questions.
I have a quick question for you, if you don't mind. When you're talking about supervision concerns specific to the people who are peer support specialists, what were the concerns they were having and troubles they were having getting the proper supervision? If you could clarify that.
Absolutely, Mr. Chairman. Some of what we face in the community and with our community providers is the use of peers. We are trying to increase the use of peers in our services and in our system. However, we are still challenged by that, and so peers working in an agency may not get enough hours as providing services as needed in the timeframes that they are required to get those hours for certification.
Okay, thank you. Representative Blanksma.
Thank you, Mr. Chairman. Just for a quick comment, and less directed at you, Ms. Clark, I'm looking at you, Josh, in the back. When are we going to be done with the ZBR? That is my question for the governor and his staff. We are now on year 6. And while I appreciate the interest of the governor initially to cut red tape, at this point in time, we seem to be counting a lot of words. And it takes up valuable time of the committee and of the agency just so that you can tell me how many words that you've cut from your code. So this is just my annual plea that we at some point in time stop this as just a standard policy and actually look at the rules and see what red tape we can cut. So not a commentary on you, just a commentary for the governor's office.
Thank you, Representative Blanksma. I don't think that relates specifically to the rule at the hand. So are there any further questions related to this specific rule? Representative Vandewalle.
Thank you, Mr. Chairman. And just one quick question on page 758, where you are including rules by reference. Those are Idaho rules. They're not federal rules that you're including by reference, correct?
Ms. Clark.
Mr. Chairman, Representative Vanderwood, they are actually not rules at all. They are principles. They're code of ethics and professional conduct principles. So they are Idaho specific, but they are based on the National Association of Peer Supporters. And those, so what we've done is we've just added some Idaho specific language to a national standard as far as making it, just adding Idaho where the national standard would just say in general. Does that answer your question?
Yes, I believe that does. I'm always a little hesitant if we start incorporating by reference federal rules and the rules get changed without us and not having any eyes on it. And so I just wanted to make sure that including by reference that it's Idaho rules that we're looking at, not something that can change without us knowing. Thank you.
Representative Wheeler?
Thank you, Mr. Vice Chairman. Mrs. Clark, I just had I guess a question. There appears to be a minor clerical error at the bottom of page 768. I just want to make sure it was able to get cleaned up before the final rule goes into effect.
Can you explain the clerical error for us?
They have spelled department with a random period instead of an M.
Thank you for catching that.
I like word games.
Things
like
are
that.
detail focused. Good job. I didn't even see that. So we'll address the clerical error at some point.
Mr. Chairman, Representative Wheeler, we will address that with our rules unit, yes.
Thank you, Ms. Clark. Any further questions? Motion would be in order. Representative Wheeler.
Thank you, Mr. Vice Chair. I would make a motion that we approve, excuse me, Rule Docket 160719-2301.
Motion's on the table to approve docket 160719-2301. Any discussion on the motion? Seeing none, all in favor signify by saying aye. Aye. All opposed? Saying nay. Seeing none, okay, the motion carries. Thank you. Docket 160719-2301 shall be approved. Up next on the agenda with Ms. Clark is also docket 160725-2301, prevention of minors' access to tobacco or electronic smoking device products.
Thank you, Mr. Chairman, members of the committee. For the record, my name is Treena Clark, and I'm the program manager for the Division of Behavioral Health within the Department of Health and Welfare. I am presenting on docket 160725-2301 that begins on page 770 of your pending rules review book. I ask you to approve this pending rule as final. Under Idaho law, retailers are required to obtain a permit from the Department of Health and Welfare to sell tobacco products and electronic smoking devices. Idaho Chapter 160725 sets the standards for implementing the provisions of the code and defines procedural requirements for tobacco and electronic smoking device retailer permitting and the department staff that are carrying out the intent of the code. The division conducted a comprehensive review of this chapter in compliance with the Governor's Zero-Based Regulation Order 2020-1 and is proposing changes to revise the rule to remove language that is redundant and to align this chapter with the prevention, I have to say it again in my head, sorry, with the prevention of minors' access to tobacco products and electronic smoking devices statute. House Bill 538 passed in 2020 expanded tobacco regulations to include electronic smoking devices, requiring retailers to obtain permit for selling these devices. And in 2022, the legislature passed Senate Bill 1284, which raised the legal sales age for tobacco products to 21. The proposed changes to this rule include adding electronic smoking devices to relevant sections and raising the legal age to 21 as necessary and where necessary. I had not planned to walk the committee through the changes in this docket. I will highlight that the majority of the changes that you see, the revisions that you see in the docket, are removing language that is duplicative of statutes, and it is adding the electronic smoking devices and raising the age to 21. Outside of that, there are really no significant changes. Other than, I would like to refer you to page 782 of your pending rules review book.
You can carry on.
Okay, section 021 on permittee responsibilities. You will see a pretty significant revision to that section. That revision really reduces the regulatory burden for retailers on their training programs and gives them more flexibility on how they incorporate the required training into their business model. You will see that the division is also proposing to remove Appendix A, employee training form, found on page 785 of your rule book, and the Appendix B inspection checklist found on page 786. These documents also impose an overly burdensome regulation, and it is not necessary to have these documents in the rule. Taking all of that into consideration, and to be respectful of the committee's time, I will stop there and going over the proposed changes, but I am happy to review any revisions or sections as requested by the committee's members. As part of the negotiated rulemaking process, the division conducted 2 public negotiated rulemaking hearings and 1 public hearing. The department did not receive any negative feedback during the rulemaking process. This rulemaking is also intended to be neutral, and there is no anticipated impacts to the state general fund or any other fund. Mr. Chairman, members of the committee, that does conclude my presentation, and I now stand for questions.
I have 2 questions real quick, if I may. The question is, how many retailers do we have that are selling? And then the second part of that is, are we conducting compliance checks on, and what percentage of the compliance checks are being conducted across the board as compared to the number of retailers we have?
I have that. Thank you, Mr. Chairman. I do have those numbers for you. We currently have 1,613 active permits. Of those permits, 143 are exclusively electronic smoking devices. We do have a compliance rate of 95%, our overall violation rate being about 4.5%. We are required by the statute to conduct annual inspections on all of our facilities that are permitted, all of the retailers that are permitted. So all of those 1,613 retailers would have received an inspection in a calendar year.
Thank you. Any further questions for Ms. Clark on this docket? Committee? Seeing none. Representative Healy?
Mr. Chairman, for a motion?
Motion's in order.
A motion to approve 16-0725-2301.
A motion's on the table to approve docket 16-0725-2301. Any discussion on the motion? Seeing none. All in favor signify by saying aye. Aye. Any opposed? Nay. Chairman votes aye. And we have approved docket 160725-2301. Thank you so much. Up next on the agenda is our final one for the day. We're doing good. We're getting through this. Docket 16-0739-2301 says designated examiners and dispositioners. Proposed rule, and Ms. Clark, the podium is yours.
Thank you, Mr. Chairman, members of the committee. Once more for the record, my name is Treena Clark, and I'm the program manager for the Division of Behavioral Health in the Department of Health and Welfare. I will now present on docket 16-0739-2301 that begins on page 787 of your pending rules review book. Today, I ask you to approve this pending rule as final. Idaho Chapter 160739 establishes the qualifications, requirements, and procedures for appointment to practice as a designated examiner and designated dispositioner in Idaho. As part of the state's civil commitment process, designated examiners conduct the evaluations to determine if an individual meets the criteria for involuntary commitment. The qualifications for who may be appointed as a designated examiner are set forth in the statute for the hospitalization of the mentally ill individuals, also known as the Mental Health Act. In 2022, the legislature passed Senate Bill 1327, which made several changes to the Mental Health Act. One of the changes made was to expand the qualifications of designated examiners by adding qualifications for a senior designated examiner. The Division of Behavioral Health is proposing changes today to align Chapter 160739 with this change in statute. The proposed changes are simple in nature and include adding senior designated examiners to relevant sections, removing unnecessary language, and changing regional program manager to hub manager to reflect the current process. It should be noted that a comprehensive review of this chapter was done pursuant to the Governor's Zero-Based Regulation Executive Order 2021 in 2022, and the changes proposed at that time were approved. As part of the negotiated rulemaking for this docket, again, the division did conduct 2 public negotiated rulemaking sessions and 1 public hearing. There was no negative feedback received on the proposed rule during the process. This rulemaking is intended to be cost neutral, and there is no impact anticipated to the state general fund or any other fund. I respectfully ask the committee to approve this pending rule as final. Mr. Chairman, members of the committee, that concludes my presentation. I thank you for your time, consideration, and attention during all of the dockets that I presented today, and I now stand for questions.
Thank you, Ms. Clark. Any questions for her on this docket? Seeing none, a motion would be in order. Representative Healy is our savior today for these dockets.
Mr. Chairman, for a motion.
A motion's in order.
Thank you. Motion to approve 16-0739-2301.
Motion's on the table to approve docket 16-0739-2301. Any discussion on the motion? Seeing none, all in favor signify by saying aye. Aye. Any opposed? Say nay. Motion carries. Thank you so much. Docket 16-0739-2301 shall be approved. And I'll turn the gavel back over to Chairman Vandewater.
Thank you.
Thank you, Vice Chair Erickson. It's always interesting to see that people are actually paying attention to the rules. Appreciate that from the committee, because a lot of times it's just like, I haven't read them, I haven't seen them. And I do appreciate the attention that's been given to the rules as they come before our committee. We will be meeting again tomorrow. I believe we might have a RS or 2 and some more rules. So with that committee, there is no other business to become before the committee. We are adjourned.